Hello, everybody. How are you doing? Are we turning to the point that our brains are starting to get a little bit soft right now? No, let me personalize that. I am turning to the point that my brain is getting a little bit soft right now. So, but we're going to get through the next bit with probably the most important part of what we have to do, which is what we're doing as we leave here. What are we taking away? So, I'll be wrapping up the conference in just a little bit to give some thanks for everything that's happened. But before we do that, we do want to take some time to come together and just have a discussion. So I'm really pleased to move into a time with co-speakers for this time. Sidile-Chitimbire, who's executive director of the Zimbabwe Association of Church-Related Hospitals, and Dr. Dennis Cherian, managing director of technical services and global practice head for health at Corus International. So both of these are well-known people within our community, and the three of us are going to have a chat up here. We've got some questions, but we're going to make it, well, I'll say more when I sit down with all three of us. So why don't we all come up here, and I'll say more about how we're going to talk. Yeah. Hello? Hey, that works. Great. Hi, V. Hi, Dennis. Thanks for coming up here to the stage. Appreciate that. All right. So we set up this time partly as a way to wrap off the conversations, to bring a summary to a lot of what we've had with an idea of what do we take away? What are some concrete things that we take away? But for that to work, we're going to have the conversation up here, but get ready with your thoughts and your questions. We're going to leave plenty of time for that. And I already told Mona that we don't need the time cards. We're good to go until 6 p.m. tonight. So I hope that's okay. Good thing you're not in charge of the time cards, right? All right. Well, why don't we get started, if I can pull that back up. All right, thanks, V and Dennis, for being here. Our advocacy voice in national and local context draws on the strength of church structures and the capacity of our health organizations to deliver. And I think we've spent the better part of the last several days talking about many facets of that. And I know I've heard so many good conversations and good comments about the presentations and the flow of all of the content. But I think at the heart, or at the beginning of a lot of this, has been the pretext that there's been a lot of difficult change in the world. And we're all coming into this time recognizing that with substantial changes in the donor funding environment, there are ripple effects that carry through. And so as we are preparing to wrap up, I think we've talked around some of that, but I would love to have your thoughts. What are the ripple effects of donor or policy changes? We know many of the challenges. What are some of the opportunities that this also creates? So I'd love it if perhaps we start with Dennis and then go to V, and then we'll come the other way. So Dennis, please.
Yeah, thank you so much. I've been in and out of this conference, so I may not have captured all of the wonderful conversations happening, but there are some things that stuck with me, and I'll reflect upon that afterwards. Obviously, the challenges are immense, right? We have never experienced something like this, probably in our lifetime, I would say. We know the impacts on the social fabric, economic impacts on communities, but I think we might be going through a time where it probably has an organizational impact that has a direct impact on perhaps the organizational identity, and including organization's vision and mission. And I think that's probably challenging. For faith-based organizations, we might be in a better place because we have access to other unrestricted resources, church-based, right? But we know many organizations were challenged because they were either exclusively or largely dependent on government aid. But the fact that it challenges our identity And we have to reshape ourselves or reframe our vision, mission, I think is the most challenging aspect if I were to summarize. But you know what? We can think business in a different way. I represent Corus International. It's okay I speak about my example, right?
Absolutely.
Yeah. So I represent Corus International. I have a long history of work for 19 years with World Vision, both in the field as well as headquarters, traveling around 40, 50 plus countries and work. And I worked in secular organizations too, including JPIGO, Johns Hopkins University. But now I again work in Corus International, which is a faith-informed, influenced organization. And so, which is a conglomerate of a very unique organization, in my opinion, which is perhaps in 3+ decades of my work experience, I think I've not come across many such organizations, or hardly any. That is a perfect mix of non-profit and for-profit. And that's what makes Corus International. The merger in 2019, the merger of Lutheran World Relief, IMA World Health, which are obviously non-profit organizations, and acquisition and merger of 2 other for-profit companies, one of which is Ground Up Investing, which is about impact investing, and the other one is CCIH Technologies, which is a UK-based company. And so, we in fact were perhaps prepared for this, or we were preparing ourselves. In other words, we were looking at how do we do business very differently. And so I would ask myself and to all of us here is, what new technical or programmatic value proposition can my organization offer? Do I have the technical niche that I can tomorrow be an advisory role to governments, for example? I'll give a very good example. And we do that, by the way. I mean, we want to do that, and we want to position ourselves to be an expert that we can come into a country and offer a niche expertise to the ministry that they feel fills a gap. Recently, we signed an MOU with the government of Tanzania, which, for example, has a very small cocoa market. But as you know, I don't know, maybe you don't know, that Lutheran World Relief has its own coffee business and coffee markets, cocoa. So, and we do have a lot of very strong expertise. So we have been asked to come in and provide TA to the government of Tanzania. Number 1, to increase production. Number 2, to put Tanzania as a major coffee player in the global market. So I think that's a classic example, right? It always often is not about a lot of money, but you bring a great value proposition. And it also helps us to think diversification of our funding. I think we have to move from a proposal mindset to a product mindset. What products do we have that we can market that the other person is going to think it's a valuable idea? It's like going to buying a Coca-Cola or a toothpaste. It's a product. So do you have products that are good enough that other people can buy? So it's a shift from a proposal to a product. Okay, proposal is writing something so that you think you will get funded. Somebody should feel I need to buy your product. So think differently. That's what we are trying to do. And then of course we have to be nimble and lean. And we have to come up with a self-sufficiency model. For example, IMA World Health, which is part of Corus International, our health arm, has a long history and presence in the DRC, for example. And recently, a spin-off was called Durable Solutions, which is focused on, for example, cook stoves, water ATM machines, for example, solar panels, etc. But these are classic examples of self-income generating, but also local solutions that are very different from most of us are used to, right? So I think those are some examples of where I see opportunities without compromising our mission, by the way, but becoming an organization that's not a handout model, right? But that are empowering and equipping local organizations, communities to stand on their own feet. I'll stop there, but there are more examples. There are other organizational examples as well.
I love that you've picked up on the ripple effects are having to do with the mission, changes in mission, changes in focus for the organization, redefining who the organization is, and that means bringing it in-house and thinking in-house about how these changes affect us. V, any thoughts, ripple effects and also opportunities?
Thank you, Doug. I think from where I'm sitting, and also having met a lot of us coming from different countries, different environments, different governments, and also whether we're coming from low-income countries or countries where the GDP is good and people are surviving, I think we're all affected because the executive order which we got had a ripple effect, not only on health, but it also affected the country's positions and also affected trade, and also affected how we look at our future as individuals because of our dependence on donor funding. So I think, first of all, we need to realize that this domestic, this foreign aid is not specific to us. It's specific to our countries. And also, this is based on the bilateral and multilateral relationships with the various governments and countries. And also, we need to look also in the US to say really what was the reason behind all this. We realized that yes, as countries were dependent, and if you look at how much the US government invested globally, it's a lot of money, and most of our countries couldn't even afford that. And then we heard from the previous speakers that we also have the Americas, the European countries and so forth. They have their policies also, and also they have their priorities. And also we find that there's wars which are happening. And now one has to think, where do I put my priorities? And also when you look internally, I think the US government also is trying to say, how best can we utilize our resources? So from where we sit as implementers, when this came, we looked internally and we realized that maybe we're looking at patients only to say how do we treat our patients. But from where we sit, we are hospitals, we are humanitarian and so forth. So if you look at the trend of which is happening, we can't treat patients without medicines. So the supply chain is affected. So there are so many ripple effects which don't really are specific to health, but are specific to how countries operate in terms of investment, supply chain, and also look at human resources, people are affected. These are the ripple effects, which have also impact on individuals, on your personal self, in terms of losing jobs, re-strategizing, to say, how am I going to look after my children? Also, you have your fears to say, for instance, if people are on ARVs, if they don't get their medical supplies, we are going to go back. After reaching all this milestone, we are going to go back and we are going to get resistance. But you realize that research is also affected. So if research is affected, how are we going to deal with diseases and emerging diseases and so forth? And then also look at pharmaceuticals with the trade. Our drugs are going to be expensive. So what I'm trying to urge is say, let's just not look at us only, but let's look at the ripple effect of all this. It's not just us. So as we now say, where are we going to get our resources? We're encouraged to look domestically, but also domestically, are we okay? And also when you look at are the governments going to support us, and how much and how, and what will make them support us, because also they're having their issues. So I think those are some of the ripple effects which you have to think about, which have impact on this. The challenges are many because one, we look at our survivalist organizations. So the resources have been taken away from us. How long are we going to survive? Where are we going to get the resources? and who do I approach now? But I think we have to advocate and also look internally in the country to say, where can we survive working with the communities or with what we have? But I'm very happy that as faith sectors, we always did more with less. We are very innovative. We are Christian organizations. We have done voluntarism for a long time, and we can use our congregates and communities to really support ourselves. I was sitting in one group and people were saying, but before pharmaceutical companies came, we were using traditional medicines. So medicines come from trees. Maybe we have to rethink, but also it's the matter of dosage so that we don't damage our kidneys when we abuse some of these uncontrolled commodities. But when you look at opportunities, I think there are many opportunities. I think we need to collaborate amongst ourselves. They like collaborating with the same people. And then also maybe looking at also revisiting our core business to say where we sit. Are we still going to do what we're doing, or now we need to change and come up with other strategies of how we're going to interact and intervene, and also how we're going to support our clients and patients. Because our role, when you look at our religious positions, is to heal the communities, give them love, support them, and save lives. So I think we need to say how best are we going to do that, and then which, of course, makes us look at our church leadership as well in terms of that. But I think also we need to build networks. We are here. I know I have exchanged business cards with a number of people. There are still opportunities there, so we shouldn't lose hope. But we are learning more things. People are doing certain things on the ground which are innovative. Let's learn on those and run with them, and I think we'll survive. So the opportunities are there. We need to, from when you live here, maybe we need to sit with governments, because when the executive order came, I was sitting and I was talking to our own people. So I was saying, the government is quiet. They are not calling us to the round table. Our church leaders are quiet. No one is calling us to the round table. So we are all doing things separately, but I think now we need to approach our governments with good strategies and ideas, and our religious leaders, and say, listen, we are here for the people. Let's work together. I think I'll stop there. Thank you.
I think you can keep that one. You know, you've really surfaced the key, what I would call chapter headings in what comes next. You speak about things like how we're setting priorities, how we're collaborating, what are the roles of networks. Let's get a little practical. Those are the whats. Let's talk about the hows. For instance, you talk about seeing if the government is going to call you to the table, or will the church leaders call you to the table. Let's unpack that for a minute and talk about practical ways to bring churches, health organizations, and governments into closer collaboration to address these and other challenges. Practical ways to bring us together. V, we want to start with that?
Okay, yes. When you look at practical ways, I'm thinking of meds. They are here. I'm thinking of Uganda is the other pharmaceutical. There's EPN,
JMS,
and JMS, and so forth. So when you look at the supply chain, already we have faith sectors which are leading that process. So I think maybe it's time to look in country where we are. To say how best can we work with these organizations, and also looking into the local manufacturing in our countries, because currently, I'll speak for my country, we don't do a lot of manufacturing of medicines. We're importing a lot of them. And also we don't have the byproducts to start the manufacturing. So when you look within the region, I think we now have to say which faith sectors can lead that process in terms of manufacturing, licensing the drugs, and so forth. And already, if you look at meds, they are set. They're testing. Some of us are still sending tests outside the country to get the results, but they've built themselves. They've been qualified, and they are also compliant with the ISOs of this world. So what stops them from leading the process in terms of manufacturing, drug quality testing, and things like that? And then also, when we look internally as faith sectors, I'm looking at issues to do, like I was mentioning, to say we work with communities. When the missionaries came, there was no government. We were all in the bush. Because I always say, how did they manage to get to the most remote places in the country and provided services there? So I think amongst ourselves also, we should now try and do that humanitarian issues of giving to our own, because this is what the church was doing before, and why did it stop? So I think that giving factor is there, and we're all experts. We've got doctors, we've got philanthropists here. We can work amongst ourselves to really come up with something, but key is to say, what are our priority strategies, and how we're going to prioritize, and which are the groups which you can work with. And we've got the ACHAP, we've got all of you here, you've got something special, but then how do we pull that together and survive? I don't think, even when you look at the funding partners, they're not saying they are pulling out totally, but they are saying maybe reorganize yourselves and see how best you can work with your communities with less. So does it mean if we have less, we can't do anything? I think we can, because we have been doing it for a long time, and the impact has been very high, and also we're not documenting. So I think we also need to sit down and document our work, publicize our work, and also make sure that we have got proper statistics and data to really give us proper decisions. Because currently, faith, we receive. Somebody is pushed to you, we receive. But we don't look at the consequences of just receiving. So I think we need to now plan around that to say, yes, we can't chase people away, but with the little resources, what are the priorities? And what do our people want? Because we're led before, but we're not answering the challenges of the people. Clean water doesn't need money, a lot of money, and things like that. So prevention issues, we can teach, educate people, and bring awareness. And then that won't have an effect of us now trying to get money for curative services, which are expensive. So let's start at the primary level, address those issues, bring awareness, educate our people, bring back hygiene. These are the basic things, and they don't cost much. Thank you.
That not having to wait for big grants to do prevention, because you can do prevention. You can preach it from the pulpits. You can share the information, and it doesn't take a lot. One talk on a radio station can reach a lot of people. V, you're part. This isn't a question, just an appreciation. We have a monthly cohort of chief executives and chief health officers that meet once a month, and there are 13 of us, and you're one of the people on that cohort. And we had a discussion topic last month, which is what can we do to strengthen quality that doesn't require a big grant. And so we framed it as, what can we do if we don't have external money coming in? And there were a lot of good ideas. I know we can keep moving, but I just wanted to shout out, you had some really good thoughts on that. So if you want to say something, great. Otherwise, I'd like to move along to Dennis, but go for it.
Yeah, I think also what I was thinking, I was like, we need to come, our visions, we need to stick to our visions. I think we talked about that. We need to think of the visions. And also we need to look at internally in terms of our human resources. Like now, a lot of people have lost their jobs. But why can't we start something on our own with those people and see how we can do that philanthropic work where they can also volunteer to reach out to our people? But I know people need to survive. Because if you look at the issues, like when we were discussing in some forums, we're like, okay, I have staff, people have been fired. There's a social impact for those people. And how then do I deal with that? Because if somebody takes resources, they are their resources. But in terms of my employment policies of the country, they are labor issues. So how do I balance that? Like now, you have taken this person and say, away, but this individual can turn around and sue me as an organization to say, well, I worked for you, but you didn't protect me and things like that. So there are a lot of things which we need to look at and think properly, because there are country laws, there are donor laws, but sometimes these have got conflict, but the donors will say country laws take precedence. So somebody can sue me for losing a job, but I don't have the money. So that means I have to sell the building which I have, or I can't sell the donor cars. So these are some of the issues which we deal with. And I think sometimes when you draft our policies, we sign agreements, those are some of the key issues which you need to look at and make sure that you protect your organization as well and yourself. And also, like if I'm going to government to ask for money, do I have an MOU with the government? Because sometimes some of us as CSOs or faith-based organizations become let me not use that word, it's coming out of we sometimes we approach them in a different manner because we are running with something. But now we're going back to the government which we're working with to say, please help us, and what approach are we going to use? Thank you.
Thank you. Appreciate that. Dennis, over to you. Practical thoughts and suggestions on any of these areas of collaboration, figuring out how to prioritize emerging roles of networks. Any practical ideas?
I think a lot has been covered, but I feel like the greatest advantage for faith-based organizations in trying to link with governments is this last mile. Often we all work in this, whether it's conflict or hard to reach areas. I think that greater collaboration can help us reach that last mile. But I also feel technical expertise, for example. Possibly a lot in Africa as well, but when I was back in India, I had a good association with the Christian Medical College, which was referenced here as well. And of course, I have a long association with CMAI as well. But these are world-class institutes that the CMC, for example, is a world-class institute where they have the best expertise in the world that can be trainers and technical experts to the governments as well, which is happening, by the way. And obviously greater coverage, where in countries like Zimbabwe, for example, the government has contracts to, right, Zach? And these are all, to me, these are maximizing the resources that are available within the country. So one is able to expand and have greater coverage, as a result of which we can avoid missed opportunities, I would say, in terms of our ability to provide care for the people. I'll stop there.
So those are great suggestions. Those are some really concrete actions, and we've talked about the what's and the hows. I'd like to shift, and in our remaining just a few minutes, I want to talk about the qualities and the attributes that help us remain hope-filled, resilient, trusted, sustainable, and effective. I would love to be able to say, I am hope-filled, resilient, trusted, sustainable, and effective. But how do I get there? What are the qualities and attributes that help us get there? Easy question. Who wants to start with this one? V's not sure. Dennis, you want to start with this one, or you want to go to V? What qualities and attributes, V?
No, you can go ahead. All right. Good qualities. I think the good qualities, maybe starting from sitting and you're sleeping in at night. I think when you have your vision, I think we've talked about that. You have your vision and your objectives and goals. I think that's where you start because that's where you're going to get the direction in terms of remaining focused in what you are supposed to do. So I think this is, as a leader, that's where you should start. And then also we do have constitutions, which we have. These are supposed, I always call our constitution our second Bible, because we're a faith-based organization. But the constitution really tells you what you are supposed to do and gives you leadership qualities in terms of your governance and also how you need to run your organization. So as we navigate this situation, I always tell people that I always look at myself as a sitting duck.
Look at yourself as a sitting duck. All right. So
as a sitting duck, you don't know what's in the bottom of the sea, which can snatch you and bring you down. And on top, the waves take charge, but you'll be just bobbing around and so forth. But the key thing which you need to do is to say, let me not sink. So how then do you not sink? I think sometimes we try and resist change, but change can be good. Meaning that I think we get strength in terms of building from these challenges. So this has to bring those qualities of a sitting duck. It means that you should have the strength, you should not have fear. And also when change comes, don't resist too much, because if you resist, you feel the impact. So I think key for us is to say, within this storm, or what was the other word Tony met? Where the storm and climate change. Yeah, also the sun will be hitting you as a duck, or the rain is raining as a duck. So the climate change also comes into play. But in terms of us, let's have everything in place where we have a vision, mission, we have got governance structures, we know our goals, we know our focus, and also we need to make sure that we create good networks within our governments and also be part and parcel of the planning process. Because we have not been fully participating in the planning process within our governments. Yes, we go and attend their meetings, sit there, but if you are in a position, I think you should now make sure target your networks for your own personal gain and also for the benefit of your organization. You don't just network for the sake of being known, but you network to make sure that when you network, you bring something home. So like when we live here, all of us must be bringing something back home. It's not that I've got a business card for her and I can phone her and send hi, but what are you bringing home? So when I go back now, I know my board will say, you went to CCIH, you said you're going to talk about this, and also there was this going. So what are you bringing on the table which is new, which can keep our organization going? So wow. I think this is where we take our strength amongst ourselves, and for our qualities which we bring, therefore, is to make sure that our organization don't fold up.
Thank you.
They stay in place.
That's incredible, and I have to say, to American ears, a sitting duck means something that the hunters will then pick off when they go duck hunting. But what I'm getting is the floating duck. You know, you're going to rise and fall. Otherwise, you also become the sitting duck. So I love that. Thank you, Dennis. You're going to in just a sentence or two, hopefully, give us a few of those big things. Before, take a deep breath. We have 15 minutes for questions, I think, after this. So please get ready. And I would love if you just have a few crisp questions or one or two what am I taking home statements that you would like to make. So Dennis, please.
Please, a little more than 2 sentences. I just want to go back to the last question also about how do we maximize and how do we collaborate. I think everything is important, but not all things should be a priority. And I started with child survival. I have a long history of US government child survival projects, which looks the same. And all of us implement. But you know what? If we are doing malaria, let's say an ex-partner is doing bed nets and SBC in a location, and Y partner is doing clinical care, and Z partner is doing indoor residual spraying. That makes the program so much effective, and you are basically maximizing resources. Whereas we find that everybody is doing all the same thing. I was recently in Sierra Leone, and exactly this is what the conversation happened. In fact, the DHMT, the District Health Authority, has no clue which partner does what there. So I think we do need to do a fine job in terms of first map and look at who is doing what, complement, so that we don't waste our valuable resources doing the same thing by multiple partners in the same location. That's my first response. That's my response to the previous question as well. But on the matter of hope, let me just give some data. Recently, I participated in a George Washington University roundtable conversation on FBOs and current situation we are in. But if this is any hope, in 2023, the total US charitable giving reached $557.16 billion, primarily domestic. A portion supports international NGOs. Was estimated at $25 billion a year, with a 7.2 increase from 2022 to 2023. I feel we have not maximized that. In other words, the same can be repeated at the country level as well. Why don't we look at localized way of funding? So anyway, there is hope. I am a huge optimist. So I reflected on this last question. And yesterday I came in around 3 p.m. and I was able to join the worship service, the singing. What a fabulous it was. I felt like the songs made my heart light. In other words, I felt like the burden, we had an opportunity to let it go. And I looked around, and what I see was a community filled with hope. For centuries, we talk about our Christian missions. I started my work starting in a mission hospital. I started for $23, give or take $1. That was what I started in 1993. But it's not much then. Today it's nothing, right? I cannot even buy a lunch. But that's where I started. And I often say, there is no experience, although I have traveled across the world, hundreds of countries, I say that no experience replaces my experience then and my job satisfaction. But what I'm trying to say is that for centuries, our missions have survived and thrived and has become a beacon of hope in the most trying times. In fact, many of our organizations were started to respond to those crises. The Lutheran World Relief started to respond to crisis after World War II. Like us, many of us sitting here. Why should we think that this crisis should challenge us? It shouldn't, right? Therefore, I think faith is the key reason or the central reason that enables us to do our work. It is our calling, I feel. And I think it's a much higher calling that these turbulent times cannot shake us. I'll stop there.
That is a great word. That is a great word. All right, taking a deep breath after that, taking that one in. Any final questions or thoughts from one or two or three of you? Can also give. Ramesh in the back. And then we'll start over here. Yeah, please. Fidelis? Yeah.
I start first. Thank you very much, and it was very interesting following up your discussions. I just want to make a contribution from an experience. Yes, the executive order has come in and the people are asking why did Africa not think about manufacturing their own medications. The African Development Bank is pumping in money in many African countries to set up big pharmaceutical industry to manufacture. But my own thinking is that they are getting it the wrong way. Setting up these big pharma companies to manufacture medications does not solve the problem. When we set up these companies without the raw materials, we are still going to be handicapped. I take an example during the COVID. My organization was able to set up a good manufacturing plant to produce hand sanitizers. But after the first 2 months of producing hand sanitizers, we could not proceed. The alcohol was not available in Cameroon. The carboma was not available. All those raw materials were coming from China. We have a good plan there, but there are no raw materials to manufacture. So what I'm thinking of, we should get into research and development. We should be able to synthesize paracetamol tablet, paracetamol powder. In Africa, they will start thinking about manufacturing paracetamol. So the thing is that everybody says, oh, let us set up manufacturing plants in Africa, but if we don't get up how we can get the raw materials being manufactured in Africa before setting up the plants, we are still going to mess it up. So I'm just a caution to the banks that are coming in, African Development Bank, pumping in money. They should put money for the right purpose. Thank you.
I think let's actually respond to that, and then we'll go to Ramesh second. So who would like to comment on that? Oh, yeah, for sure.
Thank you, Dennis. I think also as maybe third world countries, we should change our mindset in thinking. And if you look at the African continent, we've got so many resources. There's so much richness. And most of the things, the raw materials are taken from Africa, purified elsewhere and brought back to us, and we buy them at a high cost. So I think we have to come up with country strategies, or maybe regional strategies, to say how then do we build. It doesn't need Cameroon to do it alone. We can, our leaders can come together. Just want to give you a small country which was the poorest of poorest. And now it's, people are now, other African leaders are looking at these young men doing wonderful things from nothing and working with the communities. And the communities there are the ones who are running with the whole process. He hasn't brought in anything from outside, but is building from inside. So we have money, but the money is going somewhere where the priorities of our countries are not taken into consideration. So I think that we need to change the mindset. The resources are there. Thank you.
Anything to add, Dennis? Okay. Love that. Thank you. Ramesh in the back?
Yes. Thank you. Yeah, I just wanted to, it's not a question, but a kind of observation and also perhaps a question later on. In the changing scenario, what we talked and discussed, Dr. Dennis has rightly put it, from proposal to product, which is very important. How do we sell our product? But at the same time, as a Christian organizations, it's important for us to come together to have the complementary approach to give best to the community. We know that we cannot do everything, but at the same time, each one of us have something good, something brilliant, or something we are all expertise. That's one thing. Secondly, the misinformation that has been, roaming around or said. For example, I come from India, and India, taken over by Japan, and then things are moving very fast like that, we say, but things at the ground level are not pretty changed. We work with the World Renew. If you look into our projects in Jharkhand, one of the states, the tribal states in India, things are not changed. Even today, we are talking about 2025. There are blocks and districts which doesn't have a public, health centers. For a delivery, the women have to go more than 10, 20 kilometers. There is no proper road also. So how do we manage this misinformation, and how do we get connected together to be able to address these issues that are close to our heart? It is not a survival strategy that what is required. How do we ensure the poor are taken care or poor are dignified through our interventions? Thank you.
Dennis?
Again, I think, thanks so much. And again, I think our mission doesn't change. I have a very long history of working in the locations you mentioned. I actually worked in Balia, Eastern UP. The worst places you can ever imagine. It was the Wild West. And I was working there in 97, where I started the US government child health projects. Before I came, what I heard was you could find decapitated head on the walls of houses, But I lived and worked there, challenged. Everybody said, are you out of your mind to go there? I said, no, I'm going there. And I worked there for 3.5 years. And 3.5 years, I still have the statistics in my head after 30 years, almost close to. Immunization coverage that was as low as 5%. In 1.5 years, we brought it up to 75%. It's not a fiction, by the way. It's a real documented evidence in USAID projects. And access to all kinds of reproductive health, contraceptives, etc. Okay, moved from 8% to 30%. And I can go on with the data. But the point I want to make is that we were the only faith-based organization doing such an immense program, a massive program. Massive means massive in terms of impact. So much so, the primary health care center that had hardly 5 kids showing up for immunization had over 85 kids showing up on a Tuesday, I think, was the immunization day. And the primary healthcare officer was, what are you guys doing? This much of change. The dramatic change that we were able to bring up as a result of, our commitment. The government was like World Vision. I was working for World Vision. Was like, how can we partner with you? Our impact was so powerful that I myself was threatened, by the way, in terms of, because when you're strong, you are a threat. And of course, you are a faith-based organizations. When you do great work, the people are obviously whoever is not with you, they feel like you probably are now proselytizing, right? But anyway, I won't go there. But the point I'm trying to raise is that the organizational conviction and the organizational commitment is still important. Because of the reason that all of this funding has gone right now, it doesn't mean the issues have disappeared. They are still there. Kids are dying, mothers will die, right? But therefore, our commitment has to be much stronger. And I think social movements still need to happen, is what I feel. I think that one of the biggest harm that organizations are doing as a result of what happened right now, by the way, everybody went into a panic mode of restructuring and throwing away staff. But you have to have your brightest staff to counter the challenges that you have. And I feel that is one of the biggest mistakes organizations did. We also did restructuring, but I think we have our brightest minds still there. When this crisis happened, I'm giving a real life example, by the way. When this crisis happened, including myself, every member of my team member stepped up so immensely that we thought, how do we adapt to this trend or the change? So much so, within a month, we had new ideas drafted on how we would do business and new ideas and intervention areas we focused on. I can tell you the amount of interest internally as well as among external to take this to scale, including governments. But I'm trying to say is that the brightest mind should not be let go when a crisis happens. That's often the mistake people did, by the way.
Maybe just to add, I think we're not advocating that we abandon our funders. Yes, the funds have been pulled away, but I think there's still an opportunity, and this opportunity is forming good alliances amongst ourselves. And how do we form those alliances? The onus is on us to say how then do we structure ourselves, and also what can we put to the table to the funders, which is convincing enough to make them continue supporting those areas where we have gaps. we still need each other. It's not a matter of abandonment, but sometimes somebody will kick you out, and then you sit in a corner, but you have to come up with great ideas to say, okay, how then do I come in and convince this person that this still needs to continue? And I think this is where we are now, forming good alliances, showing evidence, and maybe coming up with a proper documentation which we can then put together and say, listen, we as faith-based organization, we are indigenous. We are there, we were formed, people come and go, and we always remain there, and we always work and support the poor and the vulnerable. And people trust us. So we cannot give up and lose that trust. So let's not give up. That's what I want to say. Let's create strong synergies, and then let's come up with a good approach. And I think primary health care still has to go on. We have to make sure, revisit primary health care. Let's not give up. So I have hope, and I think from the discussions which we had, and some of the examples which were given by the presenters, I think this is where we have to start, where we come up with homemade ideas, and we show that we can actually do good interventions with less, but putting priorities in terms of saving lives. So let's not lose hope. And when I came here, I was looking forward to this group, because I was like, I need to learn something and take something back home. But I've learned a lot. And all of us here, we are sitting on issues. There's leprosy, we had forgotten about it. And now we're thinking of reviving because we're focusing on HIV and something. So I think let's look at other means and look at how best we save. We've got cancers coming up, all sorts of things. Some diseases are emerging, but then how then do we put that on the table to say, listen, if our governments can't finance us in totality, we still need that support. And it's both in the Americas, Europe. Let's convince them and convince ourselves. And also ourselves we should give. Because sometimes when you're sitting in your office, you don't think about giving. Thank you.
Thank you. Thank you. Is there one other question? Okay. Yasmin.
Hi. Thank you guys so much for your presentation. This has been really a fruitful conversation and very timely. I think with all of the funding cuts that have happened, we've faced a tremendous amount of sadness and loss and suffering, but we're also faced with incredible opportunity. Whoever the funder is has the ability to set the priorities. USAID said we want to fund these kinds of projects, and that's the kind of projects that we maneuver to work towards. But we've been talking this week so much about organizations getting back to their roots, back to what their core mission is. Why were they founded? Why do they still exist? Is there still a need? And so I think there's an opportunity for the church, speaking capital C church, speaking about all the denominations being represented in this room, to step up as leaders, not just in the realm of setting the priorities, but coming alongside parachurch ministries, because they're connected to the local communities, and funding these opportunities. So my question is, how do we as parachurch ministries advocate for the church to step into this leadership vacuum that is currently existing?
Final thought on that.
I think they should have asked Father Vuyelwa what was here. That was the question for him. Yeah, but I think if we look at the churches, as mentioned before, is that the church leaders are respected by states. And they are the people who can actually open doors anywhere and come up with something. But the issue is who then gives them the right information to go and advocate for. So I think it starts with us. When we go back, we need to engage our faith leaders, and we know of WCC, which puts us together in our countries. In your own countries, you've got other faith leaderships. I think those are the people who can start opening doors for us. And they are listened to, because the church leaders, a child listens to the church leader, and the presidents listen to the church leader. So let's use that platform to actually open doors. Presidents go to church also. So I think that will be our opportunity to really ask them to advocate for the call of the nation, so that our people are saved. Thank you.
Some facts, by the way. In 2015, the US faith-based organizations reported $5.75 billion in private revenues for overseas work, by the way. And so possibly the number has grown, these are real facts. If that is true, then I guess the opportunities are still there. The question I ask is, what kind of church-to-church partnerships are possible? I strongly feel, when this crisis was happening, for example, I strongly feel that we as NGOs, that includes faith-based and secular, I feel, has done a poor job in educating the masses. That was very clear. You can challenge me on that, but it was like shocking. Forget about it. Because I have alumni groups of my past organizations and other organizations I worked in. People who worked in organizations, they thought this was a good idea, what is being done. The whole dismantling is a good idea. That means our colleagues we worked with weren't even convinced that the work that we are doing is good enough. It's not a joke, by the way. I was very upset, but I was shocked that you could even be arguing that way. When the lives that we saved does not need any more stories. I worked in life-saving jobs. I first say that when I went to KwaZulu-Natal a few years ago, I went to 3 houses, 7, 5, and a 29-year-old man. First case was TB, second case was TB HIV, and the last case was a full-blown AIDS. 9 months later, all 3 died. This was in 2006. As the first, when I saw that, my heart changed. It was the first time ever in my organization I worked, we were able to bring $1 million into that location and do community-based ARV. But I say that is the fastest proposal I ever wrote, probably, not wrote. I went into a conversation, had a 45-minute, and the donor said, I'm ready to give you $1 million. It's the fastest I've got. So we need to tell better our story, I feel. And we have not done as faith-based organizations or non-faith-based. We've not done a good job, by the way. We have penetrated these urban areas, who most of us are intellectuals here. That doesn't matter, But I feel we need to change the story. Our language and use of words need to change. We need to recraft messages in a way that the common people understand, and it connects to them. So that's where I feel we have not done a good job. So my question I ask is that how do we recraft messages and languages to be acceptable? We are all from all kinds of, perceptions and belief systems. I think we need to be able to speak to all. It doesn't mean we have to change our identity or our mission. After all, our mission is to serve everybody, to save lives. If that is true, then let's have a convincing storytelling, which we have not done a good job.
And that is what they call raising the bar. Friends, that is the ending note for our conversation here. And I am so grateful to hear that. I'm so grateful for the challenge. In times of difficulty, focus back on what's really important to your organization. Why are you there in the first place? Who are you there to serve? What are your core values? Work from that, and you'll never be wrong. In the heat of the crucible, the things that don't belong will get burned away, won't they? So that's a little bit of what some of us are going through right now. So focus, take courage. None of you are alone in this work. You've just heard these 2 expert presentations summing up several days of conversations here, and I'm so grateful for the challenge and for the opportunity to listen to them. Please thank me, or join me in thanking, thank me too. And join me in thanking Vuyelwa Chitimbire and Dennis Cherian as well. So thank you, thank you.